We're back to the Neil Haley Show and also the Media Giant Effect. And I'm excited to welcome the program, author of the Hormone Makeover and also owner of BHRT Training Academy, Donna White. Donna, thanks for stopping by. And we're going to have another topic today. How are you?
I'm doing fantastic, Neil. Hope you and your audience are as well.
All right. So our topic today that we're going to cover, which is going to be really interesting, is the difference between BHRT and HRT. Again, learning more and more about this process. So kind of tell us the difference between BHRT and HRT.
That is a great question. What is the difference between BHRT and HRT? It's all confusing. So I think it's so important that we clarify what these terms actually mean. Most people have heard of HRT. That stands for hormone replacement therapy. BHRT stands for bioidentical hormone replacement therapy. So what's the difference? Well, HRT typically means, or as we understand it to mean, hormone replacement therapy. And that can be comprised of non-bioidentical hormones. Okay, what are non-bioidentical hormones? They are hormones that do not have the same exact molecular structure as humans make. To simplify, human hormones. So when we use a bioidentical hormone, that has the same exact molecular structure. Why is that important? Because I love this analogy to help us understand hormones. Hormones have a unique molecular shape. It's something like a key, and keys fit into locks, and they fit in there perfectly because they have the same exact molecular shape, or the same shape that fits perfectly into the locks. Well, that's how hormones work. Hormones fit into a hormone receptor. And when you try to put the wrong key into a lock, I have done that, it doesn't fit all of the way correctly, or you can't get it out. Well, when you use a hormone that's non-bioidentical, whether it just doesn't fit into the hormone receptor perfectly. So what? Who cares? That's important, because if you try to put the hormone that's not the same as what we make, it doesn't fit into that hormone receptor perfectly. And that's where side effects can come into play. And those side effects can be very, very dangerous. Some of the side effects of conventional HRT, in particular, synthetic progesterone, can be increased risk of breast cancer and increased risk of heart disease and mood issues and insulin issues, or interfering with insulin receptors. So these are really important. So it's very critical when you think about what type of hormones you're going to put into your body, if your hormones are low, is which type of hormones, conventional HRT or bioidentical. So bioidentical hormones, since they have the same molecular chemical structure as what we make, it's like putting the perfect exact match into our hormone receptors. So your body can't tell if you rubbed on a hormone cream or put on a patch or used a pellet or whatever dosing form. Your body can't tell the difference if it made it or if it was exogenous or applied or used in whatever preferred delivery system. So that's when you put the hormone that was missing back into play. That's when you address symptoms. That's when you help protect yourself against diseases or conditions associated with lack of hormones or hormone deficiencies. I'd like to clarify a couple of other points. Non-bioidentical hormones, maybe what most people would call HRT,
Okay.
non-bioidentical hormones, are different from the hormones that we as humans make. And so that may be something like Premarin. Premarin is a very common form of HRT. Premarin actually stands for pregnant mare's urine. It's not the same. I mean, if you're a menopausal horse, okay, but as a female human, I don't want that in my body. It's not the same estrogen that we make. Other forms of conventional HRT can be Femhart or Provera, anything that is non-biologically identical or non-bioidentical. It just doesn't have the same chemical structure. It's not the same hormone. It's not an exact match as what we as humans make. Therefore, that's where issues or AKA side effects come into play.
All right, those side effects are the biggest reason why you recommend BHRT versus HRT, right? Because of the side effects. Tell some of the side effects of HRT.
Yes. So it is assumed, or data indicates, that when we use bioidentical hormones or BHRT, hormones that are an exact match to human hormones, that we don't incur the same side effects. So that's what, decades of data are indicating, and they do appear to be much safer. And as far as symptom relief, bioidentical hormones are demonstrating effectiveness in reducing symptoms of menopause and perimenopause and testosterone deficiency in men. Here's another place where people get confused. So it's so important that we clear up this confusion around hormones.
Okay.
There's compounded hormones. So not all bioidentical hormones are compounded. So let's clarify those definitions. So some bioidentical hormones are available from conventional pharmacies, such as estrogen patches, or there is a form of bioidentical progesterone available from conventional pharmacies. Now, some BHRT practitioners will use compounded bioidentical hormones. So what does compounded bioidentical hormones mean? What those are, they're prepared by compounding pharmacists. And that means that the practitioner can order a customized prescription for their patient. They can order however many milligrams of the hormone they want, which hormone, or a combination of hormones. It just allows the practitioner to truly customize a delivery system or a dose. So the compounded hormones can be vaginal creams, can be topical creams, compounded hormones can be pellets. So compounded hormones or compounding pharmacies do have an extremely safe record of safety and effectiveness, and compounding hormone pharmacists have served hospitals and pharmacies for hospitals and patients for years, and practitioners. So it's truly a benefit to work with a compounding pharmacist when it comes to customized and specialized needs of patients.
Wow, that's really, really interesting. And that makes it kind of like a tailorized plan for someone who takes BHRT, that it's tailored to their hormone level versus, hey, here is a HRT that it's not set up for your biochemistry, and that's when the side effects happen. That's when the difficulties happen compared to having something that's customized.
The benefits to women using bioidentical hormones is that a practitioner that's trained very well can offer whatever option that is best for their patient, whether it's compounded, whether they want a conventional prescription for an bioidentical patch or so forth. So it just gives many different options. And that's why it's so important to work with a practitioner that's trained in all of the different dosing forms and options available to you as a patient. That's where you'll get results, management of your symptoms, and that long-term protection that we all want.
All right. And people can find you two ways. What are the two ways they can find you?
I can be found on social media on Instagram, Facebook, LinkedIn, and our Facebook pages are BHRT Training Academy. Our website is bhrttrainingacademy.com. And soon coming is the Hormone Makeover. That is the name of my book that's coming out in a couple of months. We'll be on all social channels bringing that information to women as well.
All right. Thank you so much, Donna, for coming by.
Thank
Okay.
you, Neil.
You're welcome. You're listening and watching The Neil Haley Show, and we'll be back in just a moment.